Persistent stress urinary incontinence is a common complication after radical prostatectomy. Some authors estimate the proportion of stress incontinence as high as 50%. This proportion increases if patients receive radiotherapy. Although artificial urethral sphincter is the gold standard for stress incontinence treatment, there is an increased use of implantable urethral slings, especially for men with mild to moderate incontinence. Adjustable transobturator male system Atoms slings has an excellent outcome and limited complication. However, Atoms follow-up data are limited to 3 years. The objective of this work are to describe Atoms' long-term effectiveness, namely continence defined at 0 to 1 pad per day or loss less than 10 milliliters per day, its durability and safety or complication, and to analyze the factors that influence the atom explant. This study was retrospective and multicentric. Inclusion criteria were persistent stress incontinence for more than 1 year. Exclusion criteria were previous stress surgery other than artificial sphincter for more than 6 months. We used an Atoms with inguinal port in 16%, simple scrotal port in 14%, and silicone covered port in the rest. The statistical tests used were survival analysis, chi-square test, long-run test, and multivariate Cox regression model. The significance level was set at p less than 0.02 seeded. We used the statistical package SAS. The sample size was 215 cases. The main antecedents were radical prostatectomy in 92%, artificial sphincter surgery in 6%, and radiotherapy in 20%. Baseline incontinence was mild in 23%, moderate in 49%, and severe in 27%. At final follow-up, mean 6-month continence was reached in 71%. There was a significant improvement in incontinence after atom implant. This improvement was maintained until the end of the follow-up. Dryness of people who achieved continence after adjustment was maintained in 99% of the case at 5 years and 87% at 8-year follow-up. Complications occurred in 43 patients, 20%. Perineal pain was the most common, 50 patients, followed by port infection, 10 patients. Device explant occurred in 25 patients, 12%. The main reason for device explant was inefficacy, 11 cases, followed by port infection, 10 cases. The factors significantly associated with device explant were previous irradiation, severity of incontinence, and presence of complications. Cox regression model confirmed that these factors were independent risk factors for device explant. We can conclude that continence was maintained after 5 years by 71% of operated on and 89% who achieved continence after device adjustment. Complication occurred in 20%. Perineal pain was the most frequent, but pore infection was the most serious because always led to explant. Explant occurred in 20%. The primary reason were clinical inefficacy and infectious complications.